That was it. So the reason that I initially came to optimal spine was I felt very constricted in my upper back. I felt like I felt stuck and didn't have any mobility. Sometimes, and actually, I think this is probably on my intake sheet. I was also getting pain on the interior of my knees when I did sport. So those were the two main reasons. But honestly, it was feeling really constricted in my upper back, which just that really affected my life. And just feeling not free, just not being able to breathe that well. And also, I'm sure it was related. I was also getting headaches, which I thought was because I work so much on a computer, but I think it was really because my upper back was constricted.
And now that you've been having adjustments,
Yeah.
you've been having exercises, traction,
Yes.
what are you feeling?
Certainly more mobility, no more headaches, don't really have pain on the interior of the knees, and a weird and unexpected benefit is I feel a bit slimmer here. Like I didn't expect that at all. And that's certainly not why I came to a chiropractor, but I just feel like I hold my body differently and the muscles are different. Like I feel like I've gotten different muscles in my back, if that meant sides.
Okay. And what are your goals? Is there any
Yeah.
particular activities you want to do? What did this stop you doing? Was there any restrictions in your lifestyle?
Well, I think the interior of the knees. I was starting to feel older. Like there's something when you feel like, oh, I can't do those things that I thought that you were used to doing. So, and having to feel very protective of my knees. That was a new thing, and it was, mobility in yoga. You know, Also, I just think, I have a very sedentary job and sit all day, and sort of to have the exercises that I do in the day breaks up the day and actually just opens up my chest, and I feel like I breathe a bit deeper.
So you're referring to the WML
Yes,
exercises,
yes,
and you
yes.
do them during the day.
I do them during the day. Yes.
How many times during the day would you say?
Probably 4 to 5. And then actually, the other thing that I do is it the C roll?
The D roll,
The
yeah.
D roll. That, I started it and it was quite painful. And now I actually really enjoy it. So at the end of the day, for 20 minutes, lay down on it and put on a podcast. And I feel like it really opens up this part of my body.
So this is a brilliant example of a patient that is demonstrating great compliance, who have taken the information from the posture workshop, implemented that into her lifestyle, is doing the postural home exercises we are after, and she's starting to reap all the benefits of postural chiropractic care one by one. I'm really excited.
I always ask you, I was always like, am I getting better? Am I getting better? The other thing I will say is I got a proper stool like that from the posture workshop. That actually, I came out of the workshop and thought I need a proper stool. And I definitely had that
Tendency of crossing.
Yes. And every time I do it now, I sort of stop. And that has been different when I go to traction. The beginning of traction, I could feel my left hip sort of being raised against the seat, if that makes sense. And slowly, I can feel it dropping down.
Yeah. And the stool keeps you in the right position.
Yeah.
All the day when you're working, right?
And it feels a bit more active. I think that's the other thing, that the stool, I feel one, I'm breathing better, but I feel a bit more active while I'm sitting.
Instead of being in that sedentary
Yeah,
lock
yeah.
position.
And that
Yeah.
position. That I feel like when I just do that, I can see how locked my upper back was because
So
of
for
that.
me, this is a super pleasure, right? I hear somebody who has actually gotten the message at the posture workshop: mobility, mobility, posture, mobility, posture, right? All the things that helps the nerve system to work at its optimum. Let's get you adjusted.
Okay. Oh, my left shoulder is a little tender. Just wanted to say that.
Yeah. You pointed to your left and you said right.
Wait a minute. Oh, okay. It's this shoulder. And
Yeah.
yeah.
Okay.
And I don't know if like I slept the wrong way or what, but
I'm gonna look at that with
I'm
you.
sure you are.
Yes, in here. Okay.
And that was the.
Take a big breath in for me first. All the way out. Massive breath in. And out.
Oh, I felt that one.
Lie on your back for me, please.
Okay. Sometimes I don't feel it.
And just go really floppy. And smile. Big smile. And relax.
Ah, that was it.
Cool. Hand in behind your neck there. And relax. Smile. And here. Over here. And relax. Beautiful. Face over that way for me, please. Good. So now I'm going to apply a pressure here. I want you to elevate your arm all the way up into the ceiling. Okay, slowly. Go now. And straighten your fingers all the way up and down again. And again. Very, very good. And just the last one where you go even slower.
Oof.
And relax. Relax that arm down. Well done. Go up and enjoy the traction. Okay. So now, after the adjustment, we're going into the first of two tractions. So this traction, we are going to see shortly how we address a left-sided spinal curvature. So this lady has a spine that is deviating out to the left. So she's not straight. That means that her lumbar and thoracic spine has shifted out to her left, and she's putting too much pressure down to her left side because of that. So what have happened first is that her pelvic have been stabilized with a strap. You have now seen a strap going across the junction of her thoracic and lumbar spine. We are getting her shoulder immobilized with this strap, and we are using a very firm block as well to keep her in the right position. And again, with all these chiropractic, biophysical, postural, and neurological changes, the setup is of crucial importance. And then we start loading the traction. What does that mean? That means that we are slowly increasing more weight, and the time gets increased as well. So here you see from behind what is actually happening in detail. We're gonna demonstrate the cervical traction. The patient have lost about 75 to 80% of her cervical curve, and she has pronounced forward head carriage. That has also led to osteophyte formation, which means that we have got extra bone growths at the edges of the vertebrae. It's believed that that happens because you get an inflammation and injury to the edge of the disc, to the ligaments that keeps the vertebrae in alignment. And as they get injured, they attract calcium, and together with Wolff's law, extra bone is formed in the area. So what we are working to achieve here is to get a change of neck curvature, but also to get the head further backwards, so the gravity is much easier carried. Remember, the head weighs 7.8% of the body weight, basically the same as a bowling ball. So it's important that that bowling ball is sitting right over the shoulders. If it starts going forward, the physiological impact of the head becomes much more than the actual physical weight of the head. So it's important we get that neck curve right and get the posture right, and we get the shoulders back. So this traction we are doing here is applying a force backwards of the head via harness that is attached to the actual head and jaw. And then we have a pull on the actual neck in the area where we have lost the curvature. And that pull gets driven by weights that slowly gets put onto the neck, and we have a forward pull. When we do that, we have a time setting, and this lady has been doing it for a while, so we are now up to 13 minutes. When we start this procedure, we start with a couple of minutes and with very light weights and very little pull. So it's all about slowly adapting to a new position. And this is combined with home exercises. The patient will have attended the posture workshop and will have learned how to set up her computer, how to use the mobile, what is the best way of sleeping to put as little stress on the musculoskeletal system as possible and allow these postural, neurological, muscular changes to take place.